Joining us first is Lynn Detterman, Senior Vice President of the ThedaCare South Region. Lynn, thanks for being with us.
Thank you for having me.
So we're talking about the modernization project. We're nearing completion. This has been an incredible project. Can you just give us some highlights of the modernization?
When we set out to do this project, we knew that every decision we were making was going to put the patient and their family in the center. And then we also wanted to align our strategic goals with whatever we were accomplishing in this project. The first was our emergency department. We had outgrown our previous emergency department, and we needed to enhance our trauma rooms and just the overall experience for our patients. We also knew that we wanted to create space for a graduate medical education program so that we could begin our residency program and train physicians for generations to come. And then we also knew that we wanted to completely renovate our surgery department by adding also a 4-room robotic suite, because Neenah is best of class in robotic surgery. And then also we completely overhauled our inpatient behavioral health services. Not to mention various other areas such as OB and PT and OT, and then the list goes on and on.
So one of the areas that people will really notice when they walk right in is that main area. It looks completely different than what it used to. What was the thought behind the design?
Our previous main hallway of the hospital was a dark, narrow corridor, and we knew we wanted to completely overhaul that experience for our patients. And so now when you come into the space, it's open, there's natural light, there's high ceilings, and we've added a retail pharmacy, open 7 days a week with a pharmacist on duty. We have our gift gallery, and then we also have our fresh market. So our cafeteria has now moved from the basement onto the first floor, easy to access. But what we do the most of every day are our diagnostic and our lab. And so we wanted to move those very accessible to the main entrance of the hospital. Some of those services were on the second floor and down corridors that were hard to find. Now all of that is front and center.
Oh, so easy for patients. Another space that I think really stands out is the Women's Center. That is beautiful. What was the process like, and what kind of sets that Women's Center apart?
A lot of women know that it's very important to get their annual mammogram, and sometimes it's not the most comfortable test. And so we wanted a spa-like experience, the least we can do when you're coming in for your mammogram. But we also wanted to create a women's center, so we have our ultrasound services as well as our bone density services there as well.
Another area that has been updated, physical occupational speech therapy. It's very unique, very different. What are some of the features of that?
Yeah, so our previous space was really undersized, and it was actually tucked away far back into the corner of the hospital, so it was really tricky for patients to maneuver back there. Now it's in the front of the hospital in our medical office building, and the space is spacious. There's natural light coming in. There is a driving simulator, so patients that have had a traumatic brain injury, then as they regain skills, need to also relearn how to drive. And so it's a way for them to be able to achieve that goal.
Now, this is taking place here at the Neenah campus, but the modernization can truly benefit all of our hospitals, the critical access hospitals, and patients in our other communities. How does that play a role here at this campus where it's still connecting all the other services that we provide?
Absolutely. So we are the regional trauma center, and so obviously we receive patients from all of our outlying hospitals. Now with an expanded emergency department, we now have 3 trauma rooms, and including a CT that's adjacent to one of those trauma rooms. We have our new comprehensive stroke equipment, so we have a new biplane, again, serving the region. And we can't forget our new GME space. And so we will be starting a residency program here for a graduate medical education, and we will be training physicians for generations to come.
That's incredible. Thank you, Lynn, so much for being with us and helping us understand the modernization.
Absolutely. Thank you.